everyone, and welcome to another episode of Tiny Matters with Dr. K. I am Dr. Khutso Sebetseba. Today, we'll be talking about something that causes massive anxiety for most parents, fever. Now, for many families, fever feels like an emergency. Phones come out, Google searches begin, and medications are given quickly. Many parents feel like a failure if the fever doesn't come down immediately. But here's the important truth. The fever itself isn't usually the enemy. In fact, fever is a sign that the body is doing exactly what it's supposed to do. Today, we're unpacking what fever is, when children get fevers, when fever is helpful, and most importantly, when fever is a sign that something more serious is happening. Let's start with the science. A fever is when the body raises its internal temperature above normal, usually above 38 degrees Celsius. This isn't a random act. Your child's immune system releases pyrogens, which signal to the body to raise the temperature. But why? Many viruses and bacteria replicate much slower at a higher body temperature. So fever is essentially the body saying, okay, we're fighting something. Let's raise the body temperature so it's unfavorable for the virus to grow. It is a part of the immune response. Despite this, fever triggers a lot of fear. In pediatrics, we've coined the term fever phobia. It describes the intense anxiety that parents have around fever, often worrying that it will cause permanent brain damage and seizures. But the evidence tells us something different. For most infections, the height of the fever matters far less than how the child is behaving during the fever. For example, a child with a temperature of 39.5 degrees who is playing and drinking and eating nicely is far less concerning than a child with a temperature of 38 degrees who's weak, lethargic, and dehydrated. In medicine, we say, treat the child, not the number. Fever can actually be helpful in many ways. It activates the immune system, it slows down bacterial growth, and it signals to us that the immune system is now working. This is why we don't necessarily give treatment just to normalize the temperature, but rather to make the child feel more comfortable. Most fevers in children are caused by viral infections. Things like colds, flus, viral tummy bugs, and viral rashes. Children's immune systems are still developing, so infections are very common, particularly in creche and school-going children. Young children may experience 6 to 10 viral infections, even more in children that are attending daycare for the first time. One of the biggest fears around fever is febrile seizures. These occur in 2 to 5% of children, usually between the ages of 6 months and 5 years. These can look very frightening, but the important thing to remember is that these are usually self-limiting and will go away all on their own. They do not cause brain damage, and they do not always mean that your child will develop epilepsy, but as always, any seizure needs proper medical evaluation. Now let's talk about situations where your child's fever does need urgent medical attention. Parents should seek medical care urgently if the fever occurs with poor feeding or drinking, severe lethargy or difficulty waking, persistent vomiting, difficulty breathing, severe headache or neck stiffness, seizures, a rash that does not blanch, and signs of dehydration. Also important that a baby under the age of 3 months with a fever always gets evaluated by a doctor. For most children with fever, supportive care is appropriate. Parents can ensure adequate hydration, allow rest, give ibuprofen or paracetamol if appropriate, and monitor behavior and symptoms. But remember, the goal is not to eliminate the fever completely. The goal is comfort and monitoring. Now, fever is one of the most common reasons children are brought to the doctor, and understanding what it represents can shift how we respond to it. Instead of fear, Let's approach fever with curiosity and observation. What is the body trying to tell us? How does my child look overall? Thank you for joining me for another episode of Tiny Matters with Dr. K. Remember, fever is a signal and not the problem itself. Until the next time, stay kind and stay curious.